And here's the problem most people don't realize. As we age, we don't lose health first. We lose muscle, balance, and circulation. And once that happens, walking alone can actually speed up joint wear, increase fall risk, and do very little to protect your metabolism. Today, I want to show you 5 surgeon-approved exercises that are often better than walking after 60 because they protect your joints, strengthen your muscles, improve blood flow, and even help your brain. And the best part, you don't need a gym. You don't need heavy weights. And you can do these safely at home. Most people over 60 believe that if they just keep walking every day, they're doing everything their body needs. It feels logical. Walking is natural. It's familiar. Doctors recommend it. Friends swear by it. But here's the uncomfortable truth that rarely gets discussed. Walking alone is often not enough anymore, and in some cases, it can quietly give a false sense of security while the body continues to weaken underneath. After the age of 60, the human body changes in ways that walking simply cannot reverse. Starting as early as your 40s, you begin to lose muscle mass at a rate of about 1% per year, and after 60, that loss accelerates sharply. This condition, known as sarcopenia, is not cosmetic muscle loss. It is functional loss. It affects how you stand, how you balance, how you recover from a stumble, and how resilient your body is during illness or injury. Walking, while beneficial for circulation, does very little to stop this muscle decline. Here's the shocking part. Studies have shown that leg strength is a stronger predictor of longevity than cardiovascular endurance in older adults. In other words, how strong your legs are matters more for survival than how far you can walk. Walking primarily trains endurance in a narrow range of motion, but it does not challenge the muscles enough to tell the body, you need to keep this strength. Without that signal, the brain slowly shuts down muscle fibers to save energy. Balance is another silent issue. Most falls in adults over 60 do not happen because people are weak. They happen because the nervous system can no longer react fast enough. Balance is a complex conversation between the brain, the inner ear, the eyes, and the small, stabilizing muscles in the hips and ankles. Walking is repetitive and predictable. It doesn't train your balance system to respond to sudden shifts, uneven ground, or unexpected movements. That's why many people who walk daily still fall. Every year, falls are the leading cause of injury-related death in adults over 65. One bad fall can take away independence in a matter of seconds. Hip fractures, in particular, are devastating. Nearly 1 in 5 adults over 65 who suffer a hip fracture die within a year, not because of the bone itself, but because of rapid muscle loss, immobility, and complications that follow. Walking does not adequately prepare the body to prevent this outcome. Then there's the joint issue. Walking is often described as low impact, but when done excessively without strength support, it can increase wear and tear. Weak glutes and thighs shift stress directly into the knees and hips. This is why many long-term walkers develop knee pain, hip stiffness, and lower back problems over time. The joints were never designed to absorb force without muscular protection. Metabolism is another hidden casualty. After 60, insulin sensitivity naturally declines. Muscle tissue is one of the body's largest glucose sinks, meaning it helps pull sugar out of the blood. When muscle mass decreases, blood sugar control worsens, even in people who walk every day. This is one reason type 2 diabetes rates rise sharply with age despite increased physical activity. Walking does not stimulate muscle growth enough to restore this metabolic function. Bone density also suffers. Bones respond to resistance and load, not repetition alone. While walking can slow bone loss slightly, it is far less effective than movements that apply controlled stress to muscles and bones. This is why osteoporosis can progress quietly in people who are very active walkers. The bones simply aren't receiving the signal to rebuild. Even heart health, the primary reason most people walk, is more complex than it seems. Slow or moderate walking often does not raise the heart rate enough to improve cardiovascular conditioning in older adults. Meanwhile, Muscle weakness forces the heart to work harder during daily tasks like climbing stairs or standing up, increasing strain rather than reducing it. Perhaps the most overlooked consequence is confidence. As strength and balance fade, people subconsciously limit their movement. They stop bending, stop reaching, stop challenging themselves. Fear of falling sets in. That fear changes posture, shortens steps, and further weakens muscles. Walking alone does not break this cycle. The real danger is not that walking is bad. Walking is beneficial. The danger is believing that walking is enough. That belief delays the introduction of strength, balance, and resistance training until it's too late. By the time problems appear, recovery is much harder. The human body adapts only to what it is challenged by. If the challenge never changes, the body slowly adapts downward. Muscles shrink, nerves fire less efficiently, reaction time slows. Walking maintains motion, but it does not preserve function. The good news is that this decline is not inevitable. Research consistently shows that even people in their 70s, 80s, and 90s can regain strength, balance, and confidence with the right type of movement. The body does not lose the ability to adapt, it loses the signal to do so. Walking should be the foundation, not the entire structure. Without targeted movement to maintain muscle, balance, and stability, walking becomes a maintenance activity for a system that is already weakening. And that is why, after 60, walking alone is simply not enough anymore. Most people assume that exercise after 60 means walking or slow cardio, but here's the truth that almost no one talks about. Simple, joint-safe exercises often outperform walking in protecting your health, strength, and independence. The problem with walking is not that it's bad, it's that it's incomplete. Walking moves the body forward in a predictable motion, but life doesn't happen in straight lines. Life requires bending, standing up from a chair, lifting, twisting, and reacting to sudden shifts. These are movements that walking alone cannot train, and as we age, our bodies silently lose the ability to perform them. One of the most critical issues for seniors is muscle loss. After 60, adults lose about 3 to 5% of muscle mass per decade, but this accelerates with inactivity. Muscles are not just for strength, they are metabolic engines. They regulate blood sugar, protect bones, and support joint stability. When you only walk, you maintain cardiovascular endurance, but you fail to challenge those muscles enough to prevent atrophy. Research shows that resistance-based functional movements preserve more muscle mass than walking alone, and this muscle preservation is directly linked to longer life expectancy and better quality of life. Balance is another hidden factor. Most falls in older adults occur not because of frailty, but because the nervous system cannot react quickly enough. Walking does not adequately train the stabilizing muscles in the hips, ankles, and core that respond to sudden shifts. Simple exercises like sit-to-stands or heel raises engage these stabilizers continuously. In fact, studies indicate that even 5 minutes a day of targeted strength or balance exercises can reduce fall risk by up to 30%. That is not small, that is life-changing. A single fall can lead to broken bones, hospitalizations, or a sudden loss of independence, and these exercises provide a protective shield that walking alone cannot. Joint safety is another concern. Walking is low impact, yes, but without proper muscle support, even this gentle motion can place stress on the knees, hips, and lower back. Weak glutes and quadriceps shift pressure to the joints, accelerating wear and tear. Functional exercises, on the other hand, build those muscles in ways that support the joints dynamically. Wall push-ups, resistance band rows, and heel raises strengthen the muscles surrounding key joints, allowing them to absorb force properly. The body learns to distribute load evenly, preventing injuries before they happen. This is why surgeons often recommend strength and resistance exercises alongside or even above walking for seniors. They protect your skeletal system from silent damage. There is also the matter of circulation. Walking promotes blood flow to the legs, yes, but targeted exercises activate the body in ways that enhance venous return and cardiovascular efficiency more effectively. Heel raises, for instance, engage the calf muscles in a pumping action that literally helps push blood back to the heart. This second heart mechanism reduces swelling, prevents varicose veins, and even lowers the risk of dangerous blood clots. Functional exercises engage multiple systems simultaneously, muscles, heart, and nervous system, creating a level of efficiency that walking, repetitive, and linear simply cannot match. Strength training also impacts metabolism in ways walking cannot. Muscle is a primary site for glucose uptake, and as we age, insulin sensitivity declines. Walking provides modest cardiovascular benefit but does not stimulate enough muscle fiber to improve glucose control. Studies in older adults show that resistance exercises, especially those using body weight or bands, improve insulin sensitivity, reduce visceral fat, and even influence hormones that regulate appetite and energy. Essentially, these exercises turn your body into a fat-burning, sugar-regulating machine, while walking alone has only a limited effect. Posture and spinal health are frequently overlooked consequences of aging. Walking encourages forward motion, which can reinforce slouched shoulders and hunched backs. Over time, this compresses the lungs, spine, and even the nervous system, limiting mobility and energy. Resistance exercises like band rows or wall push-ups counteract this process. They strengthen the upper back, open the chest, and improve spinal alignment, which enhances breathing, circulation, and overall vitality. Strong posture is not cosmetic. It is survival. It affects your balance, your strength, and even your mental outlook. Walking alone cannot reverse the years of structural decline in your spine. The nervous system is another hidden beneficiary of targeted exercises. Every time you stand from a chair, balance on one foot, or push against a wall, your brain is forced to coordinate multiple muscles, respond to gravity, and maintain equilibrium. This neurological training is critical because cognitive decline often begins in the same areas that control movement and reaction. Studies have shown that strength and balance exercises in seniors not only reduce falls, but also improve memory, attention, and processing speed. Walking keeps you moving, but it doesn't challenge your brain the way functional exercises do. The emotional impact is profound. Seniors who incorporate joint-safe, functional exercises report greater confidence, less fear of falling, and a renewed sense of independence. Walking alone, while familiar and comfortable, often leaves people feeling weaker over time. Functional exercises restore empowerment. They prove that your body is capable of strength, control, and resilience, things walking alone rarely communicates to your nervous system. Consistency is easier than it seems. You don't need an hour at the gym or heavy weights. You can integrate sit-to-stands after every meal, wall push-ups in the morning, heel raises while brushing your teeth, and band rows before bed. Just a few minutes per day, performed correctly, can transform your strength, balance, and mobility. The secret is not doing more. It's doing the right movements consistently. And the science is clear. Even small daily functional exercises outperform walking in preserving independence, strength, and life expectancy in adults over 60. Walking is not bad. It is better than sitting. But if you want true protection against the effects of aging, muscle loss, falls, metabolic decline, joint stress, and neurological deterioration, walking alone will never suffice. The body adapts to the demands placed on it. When those demands include strength, balance, and controlled resistance, the body responds with resilience. When the demand is repetitive walking alone, the body slowly adapts downward, losing the very capacities that matter most. Functional, joint-safe exercises are the missing link, the key to reversing decline, and the proven path to thriving long after 60. The time to start is now. Every day you rely on walking alone is another day your body is missing the signals it needs to stay strong, stable, and independent. Functional exercises don't just maintain health, they restore it, transform it, and protect it in ways that walking by itself simply cannot. They are not optional, they are essential. And when incorporated into daily life, They are not just exercises, they are a lifeline to a stronger, safer, and more vibrant future. Most people over 60 think that exercise is about doing enough, going long, or keeping up with a schedule. They believe that as long as they move, they're safe. But here's the truth. Consistency matters far more than intensity. The body doesn't care about long walks or occasional gym sessions. The body responds to repeated signals. Every time you use your muscles, challenge your balance, or push your limits in a controlled way, your body says, I need to stay strong, I need to adapt, I need to survive. And every day you skip these signals, your body forgets. It shrinks, it slows, it loses resilience. Science shows that adults over 60 who practice even short bouts of functional, joint-safe exercises every day maintain strength, balance, and metabolic function far better than those who walk longer distances but only a few times a week. The reason is simple. The nervous system, muscles, bones, and even the brain thrive on regular stimulation. They do not thrive on occasional effort. Your glutes, your thighs, your calves, your core, they are not just muscles. They are your survival system. Every day you ignore them is another day they weaken, making falls, fractures, and even metabolic disease more likely. Think about this. The average adult over 65 who is inactive loses about 1% of muscle mass per week. 1% may not sound like much, but compounded over months, it translates into dramatically weaker legs, hips, and core. That loss is silent. You don't notice it until it manifests as difficulty standing from a chair, climbing stairs, or carrying groceries. Consistency is the only antidote. Every single day counts. Even 5 minutes of focused movement signals your body to maintain muscle fibers, stimulate circulation, and preserve joint stability. Balance is equally fragile. Studies reveal that daily short balance exercises like standing on one foot, heel raises, or sit to stands reduce fall risk by nearly a third. But here's the shocking part. If you do these exercises irregularly, the body quickly forgets. Neural pathways that control balance begin to weaken, reflexes slow, and small stabilizing muscles atrophy. The difference between doing a few minutes daily versus an hour once a week is staggering. Daily movement rewires the brain to respond quickly, keeps the vestibular system sharp, and maintains proprioception, the sense of where your body is in space. Without this daily reinforcement, the risk of a fall increases quietly, steadily, and invisibly. Consistency also affects metabolism in ways most seniors overlook. Muscle is one of the largest regulators of blood sugar. Every day you engage those muscles, you improve insulin sensitivity, burn calories more efficiently, and regulate energy hormones. Irregular exercise, even if intense, cannot maintain this effect. Research shows that older adults who exercise daily, even in small, joint-safe ways, maintain lower visceral fat, better glucose control, and more stable energy levels. Skipping days or weeks erodes these benefits. Your body remembers neglect more than it remembers sporadic effort. Posture and spinal health are also dependent on consistency. Weak upper back muscles, tight chest, and slouched shoulders are not just aesthetic issues. They compress nerves, restrict breathing, and reduce energy. Daily exercises like band rows or wall push-ups prevent this collapse, reinforce upright posture, and improve circulation. Skipping these exercises allows forward head posture and slouched alignment to slowly take over. Walking alone cannot correct these issues because walking reinforces forward momentum rather than counteracting spinal stress. Even cardiovascular health benefits from consistency. Walking at a slow pace is better than sitting, yes, but it does not challenge the heart and lungs enough to sustain long-term improvements. Short bursts of resistance, balance, and muscle-strengthening exercises performed daily elevate heart rate moderately, stimulate circulation, and improve oxygen delivery more effectively for older adults than occasional long walks. Regular, targeted activity signals the cardiovascular system to adapt and thrive. The emotional impact is equally profound. Consistency builds confidence. Seniors who engage daily in functional exercises report reduced fear of falling, increased independence, and higher overall life satisfaction. In contrast, those who exercise sporadically, even if intensively, often feel weaker, more fatigued, and more anxious about their physical capabilities. Fear of falling, one of the biggest barriers to independence, is prevented not by occasional workouts, but by small, repeated actions that reinforce strength, balance, and stability. Practicality is another factor. Functional exercises can be integrated naturally into daily routines. Sit to stands while watching TV, heel raises while brushing teeth, wall push-ups in the morning, band rows before bed. These micro sessions, repeated consistently, produce more lasting results than a single long session once a week. The body adapts to signals it receives regularly. Consistency ensures that muscles, nerves, bones, and cardiovascular systems are continuously reminded to stay strong. Sporadic effort, no matter how intense, cannot replicate this effect. The science is clear. Studies across geriatrics, sports medicine, and neurology converge on one message. Older adults who maintain daily, consistent movement preserve independence, reduce fall risk, maintain metabolic function, and experience better quality of life than those who exercise irregularly. The body is not forgiving of gaps, and aging magnifies the consequences of inconsistency. Every skipped day is a silent retreat for your muscles, your balance, and your metabolism. The human body is remarkable. Even in your 70s, 80s, or 90s, it can regain strength, stability, and confidence, but only if it receives constant signals. Muscle fibers that were dormant can reawaken, neural pathways can strengthen, and metabolic function can improve. The window for transformation never fully closes, but the margin of error shrinks with age. Daily, consistent, joint-safe exercise is the key to giving your body the signals it needs to thrive, not just survive. Consistency is not about punishment. It's not about rigid routines. It's about giving your body what it needs every day to maintain function, strength, and resilience. Every repetition matters. Every time you stand, push, pull, or balance, you are sending a message to your muscles, nerves, and brain. You are needed. You must stay strong. The cumulative effect of these daily signals is profound. It builds confidence, prevents falls, enhances metabolism, supports posture, and protects independence. Walking alone is passive. It maintains motion but does not provide the repeated daily stimulus your body demands to stay functional after 60. Daily functional exercises, sit to stands, wall push-ups, heel raises, balance holds, resistance band rows, are not optional. They are essential. They ensure that the nervous system, muscles, bones, and heart continue to operate efficiently. They give you the power to remain independent, agile, and strong. They remind your body that strength, balance, and health matter every single day. The truth is simple. It's not about doing more at once. It's about doing the right movements every day in a way that challenges muscles, stabilizes joints, sharpens balance, and engages the nervous system. Skipping days erodes gains. Consistency rebuilds the foundation of your body. And when you make these small daily commitments, you are investing in a future where independence is preserved, falls are prevented, metabolism remains active, and vitality continues well beyond what most people imagine possible. Your body is listening every day. If you give it nothing but sporadic effort, it slowly retreats. If you give it consistent, targeted, joint-safe exercises, it fights to stay strong, agile, and alive. That is the power of daily,